Unfortunately, there have been some very negative side effects that have happened in some of these states that have passed medical marijuana laws. We have actually seen DEA raids happen in some of these states where
Drug Enforcement Agency.
Drug Enforcement Agency has actually gone in and seized firearms in some of these dispensaries. They've seized other drugs in some of these dispensaries. Children have actually been taken out of the homes of medical marijuana families in some of these states because the drug has been abused, it has been misused. So the governor approaches this with a great deal of caution and really wants to make sure we are ensuring a secure, safe, sound healthcare system for all islands. Everybody, I think, wants to help people who are in desperate need, but when legislators are crafting policy, and I'm a former legislator, I know how hard this can be, you don't want to pass laws that actually end up allowing harm to happen in the name of doing good. I think there's a lot of unknowns here with this drug. There's been no long-term testing done. There's been no rigorous standards applied. There's a lot of legitimate policy questions, I think, that legislators and the governor want to have answered before we move down this path. How do we make sure there are no long-term side effects? And I think, again, pointing to some of the FDA research that's going on today, we want to make sure we are not harming people by passing laws. I know everybody wants to move down the path of helping others. The governor certainly has compassion and wants to do that as well. But we also want to make sure we aren't putting a medicine out on the street that we don't really know how to.
Yeah, but the governor's point when he spoke with reporters a couple of weeks ago was that this is a prescription and people are going to abuse a prescription like the kids steal the OxyContin that's in the parents' drug case. Mm-hmm. If someone steals the drug that Mr. Gare's daughter takes, are they going to get high?
Well, there's some unknowns here, Kay, and one of those is how you're even going to produce this drug. We don't know where this drug would be produced at in the state. What happens with some of the leftovers if you are using marijuana to produce this drug? Where do the leftovers of the plant go? There's some real policy issues that I think we need to be thoughtful about.